Good morning. So, how's everyone? I'm very happy to be with you today. Adjusting the camera a little bit so we can all have the best lighting. And I'm continuing to answer your questions that you are most welcome to send to info@jayo.com. info@jayo.com. So be sure to send me your questions at info@jayo.com. I'm still in Texas and in San Antonio, and today I am going to be speaking to about 4,000 family physicians. And then again tomorrow I'm speaking at the Tobin Center on the future of well-being. So today's question at info@jayo.com comes from Mark Rudis. And Mark says, "A spinal surgery has left me in continued daily pain. Is it possible to place a space between myself and the pain my body feels, like Ramana Maharishi did? I don't want to continue pain meds. Thank you, Mark Rudis of Missouri." Missouri, not misery, Missouri. Okay, so I am going to actually read to you a little bit from my notes for the next book that is going to be coming out soon with Rudy Tanzi, and the book is called The Healing Self. And I'm going to read to you a section from the book that is very relevant to the question between pain and suffering and how to go beyond pain and suffering. So this book that I have written with Rudy Tanzi, The Healing Self, actually starts off with a very simple and definite understanding, and that is that the end of suffering is a consciousness solution to a consciousness problem. No one suffers because they're in pain. Suffering is an interpretation based on all the things that lead to experience, beliefs, habits, old conditioning, and the struggle between acting mindfully or mindlessly. If you change your interpretation, your degree of suffering will change. The higher self represents a major change at the level of who am I. When you identify with the higher self, you discover the path out of suffering because you discover inside yourself that the following things are true. Number one, there's a level of awareness that experiences no suffering. Painful experiences register but do not linger as suffering, and therefore cannot be called suffering. Physical pain exists as a sensation, but this is a signal for healing. It's not a curse. The source of suffering is the same as the source of healing, your state of awareness. This doesn't mean that we have to deny the benefits of pain research and the need to relieve physical pain. The first question the doctor asks the patient is, where does it hurt? The aim on both sides is to become pain-free. Our goal, ultimately, is to become free of suffering, which can only occur at the level of consciousness. This is what the Buddha would have said. So here's a section I'm going to read to you from the book, which is going to be called The Healing Self with Rudy Tanzi. And it's called The Paradox of Pain. Few physicians specialize in pain per se. To the typical MD, pain is something to get rid of, not to understand. But if you try to understand the mechanics of physical pain, the picture isn't simple. Sometimes pain is like a rock in your shoe, which you immediately take out to relieve your discomfort, or a toothache that sends you rushing to the dentist. But at other times, physical pain isn't immediate or easily flexible. In fact, a pain that signals serious long-term damage somewhere in your body is often the last symptom to appear. Many of the most widespread disorders that medicine still wants to cure, such as heart disease and cancer, can go for years without sending the signal of pain, by which time the possibility of preventing them may be long past. Consider aging, which typically brings its share of aches and pains. They don't have to convert into a state of suffering, however, and when they do, the linchpin is a person's beliefs. In a society where billions of dollars are spent on pain relievers, while suffering is a difficult topic that most people refuse to confront, beliefs exert hidden power. A typical chain of reasoning might follow as follows. Pain creates suffering. Though more intense the pain, the greater the suffering. As we age, we expect to get increased physical aches and pains. Therefore, aging brings increased suffering. Not true. These are beliefs that have a shaky relationship to reality, but if you hold them strongly enough, the body-mind converts them into your reality. To begin with, people need to revise their belief that pain equates with suffering. Pain by itself is often something we can work through and ignore. The no pain, no gain ethos in sports is a prime example. Marathon runners volunteer to undergo considerable pain to achieve the bigger goal of victory. The desire to win can become so all-important that a severe life-threatening condition is tolerated, such as repeated brain trauma in boxing, football, rugby, all the way down to junior leagues, where a child's future health may be at stake. So you can see that the perception of pain changes. So in the book, I talk about a case of a patient named Breck, Jason Breck, who has a condition called CIP. CIP is an acronym for congenital insensitivity to pain, which of course is a very rare condition, and it's due to a mutation in a single gene called SCN9A. And in these people, there's also general insensitivity to temperature, and so people who have no ability to experience pain actually are in danger of losing their limbs, like people with neuropathy, for example, who don't have pain. And what you realize is that pain is absolutely necessary for us so that we can shift something that has gone wrong. If you don't have the ability to experience pain, then you will be in danger. And that's what happens with people who have this mutation SCN9A. So now that is still something that leads me to say that we still have to address Mark Rudis's question. What does he do? How can he separate the pain he's experiencing from the pure awareness in which there is no pain? So I'll be back to that in 15 seconds, as I have to do this to help Facebook bring this program to you. So I'm back now, and I have already mentioned the difference between pain and suffering. Now let's address some very interesting research that has been done. There's little known about mindfulness and how it affects brain activity associated with pain. So in some research studies, when researchers took a group of expert meditators who had been doing their practice for more than 10,000 hours and used functional magnetic resonance brain scans to look at brain activity associated with anticipating pain, experiencing pain, and getting used to pain. And so what did they find? When subjected to a painful stimulus, the expert meditators felt the same intensity of pain as the novice meditators, but they reported that it was less unpleasant. That is, they suffered less. In terms of what was happening in the experts' meditators' brains, the researchers commented that this difference was associated with enhanced activity in the dorsal anterior insula, which is a part of the brain, and the anterior mid-cingulate cortex. And this is called the salience network in the brain. In neuroscience, saliency refers to how much a thing stands out compared with its neighbors. But why would meditators notice pain more quickly and yet suffer from it less? And the key is that their baseline for pain was lower than the control pain. They didn't have as much anticipation of being hurt or the anxiety that comes with it. Then when pain was felt, they registered it quickly and they got used to it more quickly. This is the rather technical story told by brain scans, but it accords with subjective reports from meditators that they feel calm, centered, and at peace. Our view of these findings is simple. Consciousness can intervene to reduce suffering, even when the level of physical pain doesn't change. What do we learn from this? To be healed is to be free from suffering, and if this ideal cannot be readily attained, each of us should try to get as close as possible. And so in the book we talk about many techniques that can help overcome pain and separate the pain from the interpretation of pain as suffering. Remember, the transcendent self is beyond all experience, and therefore the transcendent self does not experience either pain or suffering. Pain is a sensory experience, and when you transcend into pure consciousness, then that sensory experience is absent. So there are many ways then to amplify this experience. Okay, we need to also get good sleep. We need to heal our emotions. We need to correct some of our beliefs. We need to do breathing exercises and breathe into the pain. As Rumi said, the cure of pain is in the pain. We need to also make sure that the food we take in doesn't increase inflammation. So all pain is associated with inflammation, which is actually a protective response. But when there's chronic low-grade inflammation, it only worsens the pain. So my advice, Mark Rudis, is learn meditation, practice mindfulness, try and get the best sleep. If you have to take a small dose of melatonin, like 0.5 milligrams, to help you reset your biological rhythms, ground yourself with the earth through either electrical grounding or lying on the grass or on the beach, and see how you can reduce inflammation in your body through all the things I've mentioned, but also by, if necessary, taking what we call anti-inflammatory over-the-counter medications. They can help. So even a small dose of Benadryl will help decrease the inflammation, but you have to address, of course, the underlying causes of inflammation as well. So I hope this helps, and there'll be many more details on this, and we can discuss this whole issue of pain in depth when the book The Healing Self comes out. As I mentioned, it'll be out in January or December. The book is co-written with Rudy Tanzi, with whom I wrote both Super Genes and Super Brain. Also, because the brain cannot do many things at once, if you feed the brain with aromatherapy, music therapy, and when you give somebody a Narcan and they are used to enjoying music, then Narcan, which is a narcotic antagonist, abolishes the enjoyment of music, which means that music creates opiates or endorphins in your body. So why not try that? Somebody is asking about valerian. Excellent idea. Small dose of melatonin or valerian is very good. Grounding is very good. And even taking a small dose of antihistamines will help if you're not allergic to the antihistamine also. Aromatherapy, sensory modulation, music therapy, gentle massage, gentle yoga, even yoga in a chair, anything that you can feed into the brain that competes with the pain signal will help you to get rid of the pain. Solongo says that grounding is very peaceful experience. Thank you, Solongo. You can find out more about the grounding research by going to jiyo.com, jiyo.com. So that's it for today. Thank you for joining me as usual, and I will speak to you tomorrow. All the best. I hope, Mark Rudis, some of this is helpful to you as well. Thank you.